Knock, knock. Hi, Lucy. My name's Jessica, and I'm your student nurse today.
Hi.
Hi. So today your doctor has ordered me to come get a nose culture from you. All right?
Okay.
Could I get your name and date of birth, please?
Lucy Reynolds, 21468.
Perfect. I'm gonna check your name band. That's good. So I'm just gonna raise you up really fast. Okay. So I'm just gonna go grab my stuff and I'll be right back, okay?
Okay.
Okay. All right, Lucy, I'm back. Have you ever had a nose culture done before?
No.
Okay. So I'm gonna have you do, because I brought you some tissues, I'm gonna need you to blow your nose for me really fast, okay?
Okay.
Okay. And blow. Okay, so I'm gonna look in your nose. Okay, it looks good. There's no irritation or anything. Okay. So I'm going to stick this little Q-tip up your nose, and I'm going to get some mucus to be able to send to the lab, okay?
Okay.
Okay. Okay. Okay, so Lucy, if I could have you lift your head up for me. Okay, perfect. So I'm going to stick this Q-tip up your nose and get a sample, okay? Okay. And then I'm going to label it. And then I'm going to put this in the bag and I'm going to bring it to the lab, okay?
Okay.
Do you have any other questions?
No.
Okay. All right, so I'll come check on you in a little bit, okay?
Okay.
Okay, I'm gonna make sure that this is the right sample for my patient. And then I'm getting the second bit of specimen from another spot in the culture. And then I'm going to read it within 30 seconds. And it is negative because it didn't change blue, so I don't see a positive result. I'm going to put it away, and I would put their culture back in a bag. Knock, knock. Hi, Lucy. My name's Jessica, and I'm going to be your student nurse today. So today I'm coming in to get a throat culture from you, okay?
Okay.
Okay, can I get your name and date of birth, please?
Lucy Reynolds, 21468.
Perfect. I'm just going to check your name band. Perfect. Okay, so I'm just going to go grab my supplies, and I'll be right back, okay?
Okay.
right, Lucy, I'm back. Do you have any questions before we get started?
No. Yes. What are you gonna do?
So I am going to have you open your mouth up wide for me, and then I have this little swab, and I'm going to touch the back of your throat by your tonsils, and then I will send that to the lab to see if there's any sort of infection going on.
Okay.
Okay. Okay, so if you could tilt your head back for me. Okay, and are you on any medications at this time?
No, I haven't filled my prescription for Zithromax.
Okay. All right, so if I can have you open your mouth up wide and say off for me.
Off.
Okay, and I am going to make sure not to touch any teeth, lips, or her tongue. And then I'm going to swab in the back by her tonsils. And I would dispose of this. And then I'm going to label. Okay, Lucy, I'm all done. Do you have any questions?
No.
Okay, so I'm gonna lower her back down. And I'm going to double bag and send her specimen to the lab. Knock, knock. Hi, Lucy. My name is Jessica, and I'm gonna be your student nurse today. So today your doctor has ordered that we come get some urine from you, okay?
Okay.
Could I get your name and date of birth, please?
Lucy Reynolds, 21468.
Okay, perfect. I'm gonna check your name band really fast. Okay, so we're gonna do a clean catch of urine today. So what that means is I'm going to give you your cup, and I'm gonna have you, when you go to pee, you're gonna spread your labia apart first, and you're gonna clean front to back 3 times. And then I want you to pee into the toilet a little bit, pee 30 to 60, about halfway into the cup, and then finish peeing into the toilet, okay? Do you have any questions before we start?
No.
Okay, so I'm gonna leave that with you, and then I will come back in a little bit to come get your specimen from you, okay? Okay, all right, I'm back, Lucy. So is this your specimen?
Yes.
Okay, so I'm gonna label it, and are you on any medications at this time?
No.
Okay, perfect. All right, do you have any other questions before I'm done, or before I leave?
No.
Okay, so I'm gonna lower you back down, and then I'm going to go bag this and send it to the lab, okay?
Okay.
I'm going to double bag it and send it to the lab. Okay, knock knock.
Hello.
Hi, Mr. Reynolds, how are you?
Fine.
Good. Okay, so today your doctor has ordered us to come get a sample of your urine, okay?
Okay.
Can I get your name and date of birth, please?
John Reynolds, 21468.
Okay, perfect. I'm just gonna check your ID band. Okay, perfect. All right, so we're doing what is called a clean catch today. So what I'm gonna have you do is I brought you some wipes, and I want you to, if you have foreskin, pull it down, and I want you to clean from the tip and work your way down, okay? Each time with a different pad, okay? So when you go pee, I'm gonna have you start in the toilet, so pee just a little bit, and then I want you to fill up the cup about halfway, and then you can finish in the toilet, okay?
Okay.
Do you have any questions?
Yes. No.
Okay. All right, so I will come back and check on you in just a little bit, okay? All right, Mr. Reynolds, it looks good. I'm gonna label this really fast, and are you on any medications at this time?
No.
Okay, perfect. All right, do you have any other questions before I leave?
No.
Okay, so I'm gonna lower you back down, and I'm gonna go bag this to send to the lab. Knock, knock. Hi, how are you?
Good, how are you?
Good. So today, the doctor's ordered me to come get some urine from little Lucy, okay?
Okay.
Okay. Can I get her name and date of birth?
Lucy Reynolds, September 30th, 2016.
Okay, perfect. Okay, so what I'm gonna do is I'm gonna clean your little baby. I'm gonna clean her with these little pads, front to back, to make sure it's all good and clean for the sample. And then I have this little sticky bag, and I'm gonna stick it on her, and then we're gonna let her pee a little bit, and then I'll take it off, okay?
Okay.
Do you have any questions before I start?
No, that sounds good.
Okay. But it's important while I'm doing this and while it's on that you don't take it off of her.
Okay.
Okay, so I'm gonna spread her apart, and I'm gonna clean. I'll let that dry. Yeah, so this little part here is sticky, and it's not gonna hurt her when I take it off, okay?
Okay.
So I'm gonna stick it on her. Make sure to keep the inside of the bag sterile. Okay, so I would cover her back up, and so we're gonna leave that on for a little bit so we can get a catch of urine, okay?
Okay.
Okay. All right, it looks like she's got a little bit of urine, okay? So I'm just gonna pull her skin, and I'm gonna pull away from it. Perfect. So what I'm gonna do is open this. And then I'm gonna cut the tip with with sterile scissors. Okay, and then I'm going to record. And I'm going to double bag her sample. Do you have any more questions before I'm done here?
Nope, I'm all good.
Okay, perfect. I'll come back and check on you in a little bit, okay?
Okay.
Okay, I'm going to ensure that this is the right specimen from the right patient, which it is. So I'm going to dip it fully into the specimen and tap it on the side. And then I'm going to compare. And it is within normal limits. So then I'm going to close this back up. And I'm going to bag it in the biohazard bag. Knock, knock. Hi, Lucy. How are you?
Fine.
Okay, good. Can I get your name and date of birth, please?
Lucy Reynolds, 21468.
Okay, perfect. I'm gonna check your name band. Okay, so I'm sorry, I forgot to introduce myself. My name's Jessica, and I'm gonna be your student nurse today. And your doctor has ordered that we come get some of your urine, okay?
Okay.
So I see that you have your indwelling catheter. So all I'm gonna do is first I'm gonna come and clamp it so we can get a little bit of urine in the tube, okay?
Okay.
So I'm gonna sit you up. And with this clamp, I'm going to leave it on for 15 to 30 minutes until we get some urine accumulating in here, okay?
Okay.
So I'm going to come back and check on you in 15 to 30 minutes. Okay. Knock, knock. Hi, Lucy. I'm back. Hi. How are you feeling?
Okay.
Okay. All right. So the rest of this procedure is very simple. I'm going to check it first. Oh, good. And we've got an accumulation of urine. So I'm just going to clean your port. I'm gonna let that dry. And I'm going to instill my sample. Okay. And are you on any medications, Lucy?
No.
Okay. So I'm gonna make sure that's all good. And back to where it is, there, where it was. And so I'm going to label. Bag it. Okay, Lucy, I'm all done. Do you have any questions?
No.
Okay, so I'm gonna lower you back down, and then I'm gonna come check on you in a little bit, okay?
Okay.
Knock, knock. Hi, Lucy, how are you?
Fine.
Good. My name's Jessica. I'm your student nurse today. So today, your doctor has ordered me to get a culture from your wound that you have on your arm. Okay, do you have any questions?
No.
Okay, can I get your name and date of birth before we start?
Lucy Reynolds, 21468.
Okay, perfect. So I'm gonna check your name band. Perfect. So I'm just gonna raise you up a little bit, okay?
Okay.
And are you on any medications currently?
Yes.
Okay, what are you on?
ANSEP.
Okay. I'm gonna make a note on that on my culture specimen. Okay. So what I'm gonna do, I'm gonna take off your bandages. I'm gonna discard of those. Okay. So I'm gonna irrigate the wound. And then I'm gonna get my culture and I'm gonna stay on the inside of the culture, making sure not to touch the outer edges. I'm gonna make sure to label and put here that she's on an antibiotic. All right, Lucy, I'm all done. Do you have any other questions?
No.
Okay. Cover you back up, and I'm gonna lower you back down, okay?
Okay.
Knock, knock. Hi, Lucy, how are you?
Fine.
Good. My name's Jessica, and I'm gonna be your student nurse today. Can I get your name and date of birth really fast, please?
Lucy Reynolds, 21468.
Okay, perfect. I'm gonna check your name band. Perfect. Okay, so your doctor has ordered that I come and get a sample of all that nastiness that you've been coughing up, okay?
Okay.
Do you have any questions before we start?
No.
Okay. So I'm gonna sit you up. And what I'm gonna have you do is I'm gonna have you take some deep breaths and then try and cough and then get as much up as you can, okay?
Okay.
Are you, okay, so if you can cough. All right, were you able to get some stuff up?
Yes.
Okay, if you can spit it in the cup for me.
Okay.
Perfect. And if she wasn't able to get anything, I would perform the physiotherapy on her. Okay, so I'm gonna label it and bag it. Do you have any questions before I leave?
No.
Okay, perfect. Do you want your head up like that, or do you want me to lay you back down?
No, I'm on the way down.
Okay. Is that good?
No. I'm on the way all the way down.
Okay. Okay. And your call light's over here, and I'm gonna come check on you in a little bit, okay?
Okay.
Okay. Knock, knock. Hi, Lucy. How are you?
Okay.
Okay. Can I get your name and date of birth, please?
Lucy Reynolds, 2/4/1688.
Okay, perfect. Check your name band. And so first, I'm just going to listen to your abdomen, okay?
Okay.
Okay. All right, so do you have any questions before we begin?
Not yet.
Okay. So I'm going to clamp the tubing. And I'm going to insert, or I'm going to insert the soap solution. And I'm going to prime the tubing. Okay, Lucy, are you ready?
Okay.
So what I'm going to have you do is I am going to help you roll over onto your left side over there. So I'm going to lift your leg up. And then on the count of 3, we're going to roll over, okay?
Okay.
Okay, 1, 2, 3. Okay, and while we're over here, if I can get your other arm to come back behind you. Okay. So you're gonna have to be uncovered, but I'll be fast, okay? Do you feel okay? Okay. You place this pad so your bed doesn't get wet. So I'm going to lubricate 2 to 3 inches of the tube. And I am going to, I'm going to spread your buttocks apart, okay?
Okay.
And then I'm going to insert the tube, okay? So on the count of 3, I'm going to insert 3 to 4 inches, all right? 1, 2, 3. Okay, how do you feel? You feel okay?
Not really.
I know, we'll try and be fast. So I'm going to instill it 12 to 18 inches above the patient. And let me know if you start feeling any cramping or discomfort, and I will slow the infusion down, okay?
Okay.
Okay. You still feeling okay?
Mm-hmm.
Okay. So once the infusion is done, I'm going to clamp the tubing. Okay, Lisa, you did good. On the count of 3, I'm going to pull it out, okay? 1, 2, 3. Okay, good. And then I'm going to discard of this. Okay. All right, Lucy, I'm going to help you back onto your back, okay? Or actually, I'm going to have you stay like this. And then if you can do me a favor and try and hold this in for at least 5 to 10 minutes, but as long as you can, okay?
Okay.
Okay. And then I'm going to come back and check on you. Do you have any questions?
No.